Welcome back to part 3 of our Physical Therapy Masterclass Explainer. Today, we're diving straight into the critical gap between clinical application and precise billing for supervised modalities. Specifically, we're looking at electrotherapy and compression. If you're a medical coder, a biller, or a PT clinician, getting these classifications right is literally the secret to saving your practice from a massive headache of denied claims. So let's get into it.
Here's our roadmap. We'll kick things off with a quick overview of supervised modalities, then we'll break down the clinical mechanics of unattended E-Stim and Vasopneumatic devices. After that, we'll synthesize exactly how to build them compliantly and wrap up with a peek at what's next.
Before we get into the weeds with specific CPT codes, let's establish a solid baseline on what this category actually is. Supervised modalities, which live in the CPT code range 97010 through 97028, are fundamentally different from your constant attendance therapies. The defining characteristic, they don't require your direct one-on-one contact. Once you set the patient up, the machine essentially does the heavy lifting. You're supervising, sure, but you don't need to be standing right there holding the device the whole time. Clinicians, you absolutely have to document this clearly. And billers, knowing this distinction is exactly what keeps you out of those constant attendance audit traps. Moving right into Section 2, Unattended E-Stim, which is CPT code 97014. Let's look at how this actually plays out in the clinic. The core difference you really need to look for in the documentation comes down to two main techniques, TENS and NMES. TENS uses low-frequency stimulation to target nerve fibers. Its main job is symptomatic pain relief and bringing down edema. NMES, though, is a bit more aggressive. It electrically stimulates the muscle above the motor threshold, specifically to force a muscle contraction. It's actively re-educating and strengthening that muscle. Because NMS actively forces that contraction, your documentation has to tell a really clear story about medical necessity. We're talking functional, restorative purposes here. You'll want to see indications like spasticity management, neuromuscular re-education, or preventing disuse atrophy and venous thrombosis. It's even used for shoulder subluxation in hemiplegic limbs. Bottom line, the chart must explain exactly why this specific active muscle contraction is clinically necessary for the patient's rehab. If it doesn't, you can definitely expect a denial. Now, for strict clinical safety and coding compliance, you have to verify that contraindications aren't lurking anywhere in the patient's chart. We're introducing electrical current into the body, right? So you absolutely cannot use this if the patient is pregnant, has a pacemaker, or has a history of seizures. You also have to steer clear of open wounds, active hemorrhages, or areas with malignancy. Spotting any of these in the documentation should immediately raise a red flag. At that point, it's way beyond a billing error. It's a massive compliance and safety issue. All right, Section 3. Let's shift gears to another heavy hitter in this category, Vasopneumatic devices, reported with CPT code 97016. Clinically, this technique uses a really specific piece of equipment. First, an inflatable garment with multiple pressure compartments is wrapped around the limb. Then, an electrical pneumatic pump actually cycles through inflation and deflation. This is fantastic for managing lymphedema, severe post-surgical edema, or preventing DVT. But coders, listen up. This is strictly contraindicated if the patient has an acute DVT, congestive heart failure, or severe peripheral artery disease. If you see CSF or severe PAD in that chart, 97016 simply shouldn't be billed. The absolute key word you have to remember here is powered. To successfully report 97016, the device must be powered by physical compression, like that electrical pump we just talked about. This is what sets it apart from simple static wraps, compression stockings, or ACE bandages. If it's just a tight wrap without an active powered pumping mechanism, it is not a vasopneumatic device. Section 4. We know the clinical side, the machinery, the safety protocols. So how does all this translate into clean paid claims? Here is the golden rule for your billing department. Both of these supervised codes, 97014 for unattended E-Stim and 97016 for Vasopneumatic devices, fall firmly into the untimed, service-based category. What does that mean for you in practice? It means whether that machine runs for 15 minutes, 30 minutes, or even 45 minutes, you bill the code exactly once per session. The clock simply does not matter here. And on top of that, it doesn't matter how many areas you treat. If a patient gets unattended E-Stim on their lower back and their right shoulder during the exact same visit, you still only bill 97014 one time. It's based purely on the service being provided, not the time spent or the anatomy. Billing multiple units here is pretty much a guaranteed way to trigger an audit. Section 5. Up next, We've built a really strong foundation today on these two heavily used modalities, but we're just getting started. Join us in part 4 of this Explainer series, where we're going to tackle the rest of the supervised modalities. We'll be breaking down the clinical definitions and billing requirements for paraffin baths, whirlpools, diathermy, infrared, and ultraviolet therapies. Understanding the difference between what a machine does clinically and how it hits the billing ledger is the true key to running a compliant practice. So, honestly ask yourself, how much revenue is your clinic leaving on the table or risking in an audit simply by confusing timed therapies with service-based modalities? It's definitely something to think about. Until next time, keep your coding precise, your documentation spotless, and decode healthcare with Harshal.